Hey guys, Dr. Justin Marchegiani here. Today we're going to be talking about microneedling, how to microneedle your hair in 5 minutes or less. I'm going to dive in here real quick. I'll put links down below for all the products that I recommend so you guys can find good stuff. Before we do, please smash the like button. Make sure you subscribe to get notifications of more great content coming your way, and put your comments down below. We'll be checking those comments as well. All right, so diving in here, you guys want to use microneedling to improve. You can do your skin. We'll keep it to hair today. You can just apply it pretty simply. My microneedling device right here, Dr. Pen M8. It's an excellent device. It's the new one out. This is great. It's always on sale on Amazon. I'll put some links. Really important. If you want to be extra careful, you can do a 16 pin and you can get a fresh one every single time. It looks like this in a little baggie, and it says 16 needle. This is good. You can store it for a couple of times, put it in a shot glass with some alcohol and just clean it off, get some distilled water, RO water, take the alcohol off of it, pour it, you can blow dry it, let it get nice and dry, and then you can use it again, or you can start fresh. I mean, you can get 30 or 40 of these. Make sure you buy them directly from the manufacturer. You don't want to get anything dull or anything cheap. You want to get the official manufacturer type. These are all sterilized and clean and put in little baggies so it keeps it from being nice and clean and doesn't have any debris on it where you could have an infection. So I've been doing this for years, or at least a year. It's been very good. Here's the device right here, and it has, you can see, if you turn it, like it has, for instance, 0 to 0.25 millimeters to 0.5 to 0.75. You can see the little arrow there, and it's like a really faint, but 0.75 to 1. So you can time it all up. For the scalp, I want about 1 to 1.5. 1.5 is great. So if it's like more meaty, like in here, no problem. Here, if I start getting to like the side of my head, like right here, it can be a little tough. But really quick, I'm going to just give you a little overview on how I do it, just so it makes a lot of sense. And we'll put links down below for all the things I recommend. Here's the device like this. Here are the heads. Pull this guy off. And then here are the pins right here. Really, really small. Lock and load like this. Turn it right in. I'm going to start off at 1.5. So 1.5 is lined up right there with this arrow. So with that arrow right there, 1.5. So big benefits, right? What are you going to get? Stem cell improvement. You're going to get blood flow. If you time it up with minoxidil or anything else nutritionally, you're going to create channels to get those nutrients and compounds to the hair to stimulate growth. If not, you're going to just allow for better penetration of nutrition down to the hair, better blood flow, and stem cell productivity. If you're using minoxidil, this is going to activate the minoxidil sulfase enzyme in the scalp, which is going to convert and activate minoxidil to minoxidil sulfate. Again, you get that when you take it orally, but there's some pericardial effusion side effects you got to be careful of. You don't get that topical. So put it here. I'm going to put it on the highest setting, 6, just like that. Pretty simple. And then all I'm going to do here out of the gate is I'm going to just, so you can see it like that, all I'm going to do is just trace here and go right back. A little painful. You'll get a little histamine response. But I can trace here. And if my hairline, like let's say I'm a tiny bit receding here, I can go a little bit below it. That's totally fine, right? Because I want to create maybe some growth factors there. So maybe my hair can migrate a little bit more south, right? That's totally okay. And then I can come right down here, the side too. And I get a little bit gray right in here, like a little gray. So I'm going to try to get some growth factors in there by just getting some good microneedling in. And I'm just tracing it, like kind of my philosophy as I pretend like it's a little mini comb, and I almost just pretend like I'm combing that area just gently. So it's like I got a little 16-pin needle comb, and that's kind of how I think about it. I just try to comb the hair with the microneedling device, and I'll kind of straighten it off with my hair with my hand afterwards, or you can use a comb too. Like you could easily just just kind of line it up and do a comb. I prefer my hair just because it's easier to kind of just have a little bit more control. Let the hair fall between my fingers. So pretty simple. And then you could basically do that twice. Little painful, little histamine inducing. Ooh. It's always like, this area is always the toughest. And you try to, if this is my head, for instance, I'm trying to be a 90-degree angle, right? You don't want to like angle it or angle it. So I'm just trying to always change the angles. Make sure it's like 90 degrees. Much better than a microneedling roller, by the way, because the roller is going to come in at a 45 and then roll out at a 45. Here's the roller. It comes in and then out at a 45, where this is just 100% jackhammer like the whole time. I can come right in here. I'm getting a tiny bit of gray, and I can work on that and just really just get some good stem cell and good blood flow growth right in there. And if you get a little bit of like temporal recession happening, you can get that going right in there too. So now I can go back over it again. And you can go back further if you want. It's got a little blurry here. Hold on. Let me get a little reset. Bink, bink. There it goes. Yeah, it's picking up my hands here as I go closer, so it's getting a little bit fuzzy. Hold on. There. Come on. Hold on, guys. Trying to let it get a little bit in focus. I'm having a little bit of a histamine response right now. So now I'm going to try to go do my scalp. There it is. Got it. Perfect. We're back. Yeah, the autofocus on my camera comes out a little bit sometimes. All right, so now I'm just doing my scalp, my vertex here. So what I'd recommend is you just kind of come down, and I'm just basically doing tic-tac-toe. Same kind of thing. Got a little bit of a runny nose. It's that histamine response. All right, so I'm coming right down to the scalp. You can go right in the middle of the scalp, and then you just go up. I try to go down with it. Go right to the middle, come right down. Middle, right down. Middle, right down. Middle, right down. So if you get good, you can do one pass in 5 minutes. If you do a couple passes, it may take 10. But the nice thing, you have this on 6,000 RPMs. Every second or two, it's giving you like 20 or 30 pokes up and down. So it's pretty powerful. And I can go right up the hairline like that too. Right over. And it'll feel like a little bit of a sunburn on your scalp afterwards. You can do a little biotin spray or hyaluronic acid spray. I keep it really light and gentle. Just something very gentle, very anti-inflammatory. I don't want to put a lot of oils on it or anything like that. If you're going to time up any minoxidil, you can do it. Wait at least 30 minutes or at least that night. Minimum 30 minutes. But the data shows that when you add in the minoxidil with microneedling, it's a 400% improvement based on the channeling and based on the absorption and based on the activity of that minoxidil sulfase enzyme. So pretty cool. All right, that's pretty much it. I may hit it again tonight, but that gives you a pretty good idea how to do it. Done some videos before. I just want to make it as simple as possible. You can do it on your face too. If I did it on my face, I go to maybe 0.5 to 1. And then you can just go like little tic-tac-toe lines, 1, 2, 3. Or you can just do little circles and then just widen it out. Little circle, widen it out. Little circle and widen it out. Nice and slow. And you can do numbing cream on your face. Not your hair though. Put it on your face. But not too bad though. Pretty straightforward, pretty simple. I'll put links down below so you guys can see it. And that's a great routine to add to your natural kind of aesthetics improvement, and it will help your hair grow better and you keep the benefit. So a lot of improvement there. All right, guys, if you want to reach out, you want more functional medicine support or hair support, links down below if you want to reach out and get associated with myself and my team. We're happy to help. We see patients worldwide. All right, guys, take care. Have a good one. Bye.